Over the past 20 years, I have seen thousands of patients who have had concerns about their memory. A lot of people in their midlife, once they're in their 40s, 50s, start to wonder if their memory lapses are early signs of Alzheimer's disease. This is a very common condition that I encounter in my patients, and I have very specific treatments that really work. I would like you to appreciate that if you do have memory problems, the possibility that you have Alzheimer's is extremely low. In my experience, it's rare that a person in midlife who comes to me with concerns about their memory actually ends up having Alzheimer's disease. When 99% of the time, they have other conditions. These other conditions include insomnia, sleep apnea, excessive anxiety or depression, vitamin deficiency, or undiagnosed attention deficit disorder. For example, if you have sleep apnea, if you snore at night and you feel tired during the day, you cannot think clearly and you're forgetful. If you only sleep 4 or 5 hours a night and you'll wake up a lot during that period that you're asleep, you will not be able to function well, and during the day you will have poor memory, poor attention, you also will be irritable. Patients who have vitamin deficiency, such as B12 deficiency or vitamin D deficiency, or people who have low or high levels of thyroid, may also have memory problems, which is totally separate than having Alzheimer's disease. Now, patients who have attention deficit disorder have difficulty maintaining their attention when they acquire new information, and to them, that is memory loss. Yes, that's memory loss, but it's because they never acquired information in the first place. So memory loss is really not the correct label for the problem they have. They have poor attention, which then leads to have difficulty remembering things which they never put in their brain in the first place. So when I evaluate patients for memory issues, I go through those conditions, and if they have those individual medical conditions, I treat them aggressively, and people get better and go on with their lives. I emphasize to my patients that those conditions, such as insomnia, sleep apnea, vitamin deficiency, too much stress or anxiety, all of those can literally shrink the memory part of the brain, which is called a hippocampus. This is the part of the brain size of your thumb. You have one on the right, one on the left, and it shrinks, especially after 50s and 60s, by about 0.5% per year, especially if you have multiple risk factors, which we just talked about. So these need to be treated so that you reduce your risk of cognitive decline when you're in 70s and 80s. Now, there are ways that you can grow back this hippocampus and improve your memory and attention within weeks. In my 12-week program, more than 80% of patients have objective improvements in the cognitive scores, and most of them feel much sharper, both with memory and energy. What are the components of this program? You need to exercise 3 hours a week, whether it's 1 hour 3 times a week or half an hour 6 days a week. As long as you have 3 hours a week, you're good. You need to stay fit, and you have to work hard to maintain a healthy level of fitness. Mediterranean diet has remarkable benefits for brain health. Junk food causes inflammation and shrinks the brain, and Mediterranean diet has many components that are anti-inflammatory and help to reduce the inflammation and make sure the brain is healthy and strong. I recommend omega-3 fatty acids at a dose of 1,000 milligrams for all my patients, in addition to them eating a Mediterranean diet. Third factor is sleep. Sleep issues are treatable, and you must make that a priority to make sure that if you have sleep apnea, it's treated, and if you have insomnia, it's treated. You need to sleep 7 or 8 hours a night, and that really can happen with little effort. Now, another important way that you can improve your brain vitality and grow the size of your hippocampus is meditation. Sitting quietly for 10 minutes a day, 5 days a week, even if you don't repeat a mantra, can do wonders for your brain. And I strongly recommend meditation or this breathing practices to all my patients, and I do it myself. Finally, you need to do brain training. Now, you could do Sudoku, you can do crossword puzzles, but I recommend doing things you find enjoyable. You take a pottery class, join a book club, or challenge your brain by memorizing long lists. There are memory tricks which I can show you in my other videos, and these memory tricks can show you how you can memorize a list of 100 words or memorize a deck of cards. When you do these kind of exercises and you realize how sharp you are, how good your memory is, you're more likely to take on more memory challenges. In summary, if you have memory issues, it does not mean you have Alzheimer's disease. It means you have a lot of little things that need to be addressed and treated. And when you take care of each one of those little things and make sure they're all addressed, you will see remarkable results in a matter of 12 weeks. Go try it. Good luck.